I don't know what the local health department, well, let me do it the other way. Where do they say this spread is coming from?
What you said, living room spread, small group gatherings in private homes.
Yeah. Well, every expert says the same thing. Every expert, every state, right? Democratic states, Republican states, big states, small states, Democratic experts, Republican experts. The highest rates of spread are gyms, restaurants, bars, gyms, home gatherings. The situation where you actually have the least control is home gatherings. CDC says only your household. How would you ever enforce that? I don't know. That's Donald Trump. Joe Biden says celebrate only with your household. We have a rule no more than 10. That is very, very hard to enforce. Bars, restaurants, gyms, you can enforce. Those are the four main spreaders. So you do what you can with those four main spreaders. If that is true, what the Monroe Health Department says, that is a national anomaly. I can tell you that. Do you know, either of you guys know more than that?
I don't know what the Monroe County Health Department said specifically, but remember the approach. It's about the high-risk activities, the low-risk activities. When you're in a beauty salon getting your nails done, if you're getting your hair cut, you, by definition, can't be socially distanced. You're indoors where the air circulation isn't as great. You're in closer proximity to one another. Same thing in gyms. Obviously, when people are working out, they're breathing much more heavily. People are on machines. Hopefully, they should be socially distanced if they are following the protocols, but it's not all instances you are. And the issue is you're trying to decrease the rate of spread. When you're seeing these, when you're hitting these percentages, there's a greater chance of community spread. And so what you're trying to do is you're trying to address, as the governor said, businesses that are higher risk, that are known to cause spread of infection, because you don't necessarily know every single contact trace, every single source of infection. So those are three areas that we know from the duration of COVID that has spread. And so what you're trying to do is to stop the community spread and lower the chance that you're going to continue to cause spread. So you are closing businesses where there's a greater chance of spread by virtue of the closeness of the people that are working with one another, that are doing in-person services, or again, like in gyms where you're breathing more heavily, you're closer in contact with one another.
Inside your restrictions, they follow the restrictions that you put in place for them to reopen, which would have alleviated some of what you're talking about.
The restrictions are great, and we saw at moments through this for months and months and months that the restrictions have worked. But what you're seeing in these areas with these spikes is that there's a greater prevalence of community spread. And so when there's a greater prevalence of community spread, yes, these things are helpful, but they're not bulletproof.
Governor, I want to ask you about Erie County. You said microcluster zones work in Erie County. The positivity rate has started to level off, but it certainly hasn't gone down since the microcluster zone was put into place there. Is it working in Erie County in your eyes? What's happening?
Well, a leveling off, when the line is going like this, and then the line changes and levels off, that is working. You're right, you'd love to see up, level, down, but level is working, right? Because that was an arrow headed straight up.
So at what point do you indicated a couple days ago that Buffalo is very close to becoming a threat. We didn't get that announcement today, but what are you looking for?
Well, we're watching the numbers. We're going to watch through this Thanksgiving season. This is where I think if we're going to get into trouble, you're going to see it a few days, 7 days after this Thanksgiving weekend. You'll start to feel the number. We're also going to be doing, we've been advised to do now a winter plan, which adds factors to the yellow, orange, red. primarily hospitalization rate. We have to prioritize hospital beds. We have to make sure we don't overwhelm hospitals, and we don't go back into the emergency field hospitals. So we're going to watch the numbers over Thanksgiving. We're going to add in factors in the yellow, orange, red zones, primarily hospitalization rate, and prioritize those zones that are generating the highest hospitalization rate. And then we'll have announcements. The great fear is two things: overwhelm the hospital system and people die. Those are you want to get to the bottom line fears. Those are the fears. Overwhelm the hospital system, people die. Just going back to Monroe for a second. You had 75 people hospitalized November 4th. You went to 268. That's a 257% increase. It's one of the highest increases in the state of New York. What happened? And if they knew what was causing it, why didn't they stop it?
Well, like you said, it'd be difficult to enforce the 10-person gathering.
So in the 257% increase all came from small gatherings?
I'm just telling you, the health commissioner said that he has not contact traced one case back to a gym,
Yeah.
hair salon, or a barber.
Well, then I would say to the health commissioner, you have a 257% increase. Obviously, you haven't figured out what's causing it, and if you have, you haven't stopped it. But if that continues, you will overwhelm the hospital system in a matter of weeks.
I have another question regarding microclusters. So we have some businesses going into orange today. We've seen situations where there could be a business in orange on one side of the street, a business in yellow on the other side. And you said microclusters work. Some people are wondering, are they as effective upstate as they are downstate? And it's so easy to go between the zones.
It's just as easy downstate. There's no difference. Downstate you also have across the street, because you have to draw the line somewhere, right? And wherever you draw the line, there's always going to be somebody on the other side of the street. That is an unavoidable situation. I mean, just think about it. You're focusing and defining a zone. You have to draw a line around the street. And yeah, then there's always somebody on the other side of the street or one block away. That is an unavoidable consequence.
I mean, in New York City, it's actually worse, right? Because in New York City, like literally, it's drawn on a street, and you're in an area where everyone's walking, and it's even more dense.
And I would add as well, we've seen in upstate, Broome County is a good example, and other places where zones have been implemented, and you've seen positivity, new cases per capita, daily hospital admissions reduced in a significant way. So this is both the restrictions, it's also a message to the community that you have a serious issue here in your community, and if action is not taken, the restrictions will get tighter because we have to. As the governor said, it's about the hospital system, it's about saving lives, and if we don't take this action now, we know what's coming ahead. We know what the projections show is coming ahead.
Is there a concern though for people going into orange just go across the street?
Of course, yeah, sure, they will. But the main point of the microcluster zone is this. Number one, the variance on the infection rate statewide is incredible. You can take one, even downstate, Manhattan, at one area, you have some neighborhoods that are at 0.6. You have some neighborhoods in Manhattan 5 times the infection rate. 2 miles away. The way your community acts makes a difference. And that's why the microcluster points that out. You on 152 Main Street, you have a 4% infection rate. This is not in the abstract. Monroe County, the city of Rochester. 152 Main Street, you have a problem. I live on 152 Main Street. Yeah, I know. It's your house is in that zone. Oh, I better be careful. I better be careful when I go to the store. I better be careful when I get on the bus. Yeah, you better be. So it brings it to a focus where people actually get it, and then you can improve it in your community. Once that attention goes up, you mean it's my neighborhood? Yeah, your neighborhood. Not her neighborhood, your neighborhood. That focus, that attention, because it's just your behavior. Okay, now you got my attention. I'm going to be more careful. And I think that's one of the reasons why you see it coming down.